So, Father Séamus, it's your turn.
Oh, it's my turn. Okay.
You didn't come that late.
Do you think I need a microphone?
Would you like a microphone?
Thank you. So, good to see many of you again, and I'll be hopefully fairly brief so we have enough time for some conversation to take advantage of the comments we've already heard, but also I think the richness that's in the room from your own experiences. So it's important that those get into the mix as well. I basically have 3 or 4 fairly straight-on points. I'll elaborate a little bit on them, but not in great detail. I think it's fairly clear to us, and without looking very in-depth, that the mission of faith, of healthcare and health and well-being is in the root of most faith traditions. If we restricted, which we, even if we have to talk only today of the Christian tradition or the Abrahamic faiths, it's there. But in the Christian tradition, we immediately look to the life of Christ and his activities and what he did. And so much a part of the stories and the narrative that is shared with us. Right? There are many of them about healing, many of them about well-being, some of them are about miracles. Right? But they're very much a part of the way that his ministry is defined and lived. And we read those stories fairly regularly when we listen to the lectionary or any other biblical readings that we do. And so it's very much a part of the mission of the religious person is continuing to be faithful to that tradition of the traditions that they are coming from. I think the second point I want to make is that I think for the church and for many faith traditions, and this is true of the Islamic tradition as much as the Christian tradition, that we accompanied many of the great advances in medicine throughout the ages. So that they were very much a part of the conversation, the research that was being done, even though some of it was quite small, but indeed very much a part of the learning process that brought new ideas, that brought new tools, that brought new approaches into the mix. It was funny, I had the pleasure of watching the play St. Joan by George Bernard Shaw in New York last night. I don't know if any of you have ever seen it. It's quite long, so be ready to sit for about 3 hours when you do. But at one point when Joan is imprisoned by the church authorities and the state and about to be tried as a heretic or a witch, depending on whose side you were on, she was not doing very well, and she was in the clinic, and they brought her in out on the stage and said, well, why hasn't anybody taken care of her or helped her? And the answer was nobody would do the traditional bloodletting, which was then seen as part of the medical care that somebody was given, because they were afraid that the witchcraft that was in her would spread out into the air and contaminate the entire community. So George Bernard Shaw, you can imagine, has a great time with that little piece of the story. But that to the side, that's been very much, I think it's important to see the accompaniment of the learned tradition and the research that the church supported in so many different ways. Delivery and access have always been the two the two hallmarks of the tradition. And I think it's fair to say you could put education alongside medicine. Right? And that's played out in the history of the Catholic and the Christian traditions for sure, that education and healthcare and delivery of and access to both of those was something that was almost in the DNA and the structure. It was at the heart of the charism of numerous religious congregations that were founded over the last 700 years. Right? Education, healthcare. Education, healthcare. Open a school, open a clinic. You could still see it going on today, whether you go to Pakistan or Bangladesh or in remote areas of Latin America or Africa, possibly before the community builds the church, they build a school, or they open a clinic. And trying to supply the needs that those institutions could offer to local communities is almost in the, as I said, in the DNA of the leaders of those institutions. I think it's important for us to realize that that has remained very much a part of the institutions and the organizations, even though many of you in the room could speak to this more than I, but this has changed dramatically in the United States over the years. Right? From all of the individual hospitals that were established as part of the charism of individual dioceses or individual religious congregations, we now have an almost covenanted system of umbrella-like hospital systems that are from the Catholic tradition, but also from the Methodist tradition, from the Adventist tradition, from the Jewish tradition. So you can see when you go by these hospitals, the names of the religious communities are still somewhere in the middle of that mix. Same thing would be true of many of the nursing home and assisted living institutions that exist. They were also seen as part of that, and you could also go to the other end and say they were also very much a part of providing health care to mothers and to newborn children. Right? So that has remained consistent and continues to be a very important part of the mission. I think the crucial maybe point that merits reflection is how over the years you got from what would essentially be seen as a private system of education and a private system of healthcare to a public system of education and a public system of healthcare. So how did the church communities and the faith traditions, how did they navigate that transition? I think maybe there was a recognition early on that the scale alone was not going to be met by the private sector. We're seeing that in the Millennium Development Goals, we saw it, we're seeing it in the Sustainable Development Goals, that there is some combination of what the private sector does, whether it's philanthropy or charity, and the public sector, whether it's government or quasi-government organizations and institutions. And there is a clear recognition, somehow, hopefully they're driving the car in the same direction, right? And they're cooperating and collaborating. And we could, I'm sure, offer many examples of that. Jason offered one. We could also talk about the PEPFAR response to malaria and to HIV/AIDS. We could talk about the different ways that pharmaceutical companies have connected up with hospitals and delivery systems. So there's a number of examples, but that negotiating and navigating that transition continues to be a real part of the conversation. Who is responsible for the provision of access to education and health? And how is it organized? And is the access equal? Those are still the questions that we end up debating, right? And how are the poor treated in the midst of that? Are those who are excluded or left out? And so, you know, that's also been a part of the whole question we had early on about the discussion about healthcare as a right. Right? You remember John the 23rd in Pachman Terrace, right? Talked about political and civil rights, which we're all familiar with. But then there were also economic, social, and cultural rights. He enumerated something north of about 55 different rights within that encyclical, drawing on what he and what others saw was embedded in the UN Declaration of Human Rights. Right? So in many ways, we're still working out of that question about social, cultural, and economic rights, how those are respected, how those are promoted, and how those indeed are operationalized in terms of access in local communities, regional communities, and globally. And it seems to me the faith traditions play two roles here. Right? They are generally in the midst of continuing to provide some of that access, although some of it is extremely expensive. If you look at the average cost today, for instance, of a primary school education in a Catholic school. I was visiting some school last week or 2 weeks ago up in New Jersey, giving some talks to the juniors and the seniors. It was a secondary school, actually. The tuition was $45,000 a year.
Oh, goodness. Well, that's the East.
That's the East, right? There you go. I'm sure if we looked around, we might find a few of those in Texas, but we won't go there this afternoon. But what I'm saying is that access is, and we know the challenge that's been there in continuing to provide access at a reasonable level that has moved very far away from where the creation and establishment of these schools started, clinics started, or hospitals started. And so the church continues to try and navigate that kind of obligation on the part of the government, responsibility on the part of the government to provide access. Providing access on their own, but also what I would call doing the second part is doing the advocacy piece or the monitoring piece of how the government is actually organizing and delivering. And I don't have to talk to you about this massive debate that we just went on about the Affordable Care Act, right? It was about, access to affordable health care for citizens in the United States, and that continues to be played out today. But it was fundamentally, how is the access to health care and the delivery system organized? Who has access? How is access facilitated? And who pays for it? So we realize very clearly that we're not out of the woods on that conversation. That conversation, as Jason mentioned, also goes on globally. Right? So we have the World Bank and the IMF meetings are in Washington next week. That some of you in the room are familiar with. But those questions come up at that level as well, because the World Bank is the institution that is there to hopefully serve the poorest of the poor in the countries around the world, deliver capital to governments or lend money to governments who want to establish healthcare systems or education systems. So, fortunately, faith communities do try to activate and have a voice in that debate as well, by participating in the meetings of these institutions. Same thing you could say about the UN, right? Those kinds of discussions about the right to health, the right to water, the right to any of those things are very much a part of the system, but how they're operationalized and delivered, and how countries that need assistance in order to be able to do that is a very important part of I would say, of the justice ministry and advocacy that faith traditions perform. So, quality, access, regulation, all of those things are very much a part of what the conversation is about. I want to close, however, by also mentioning that I think the Laudato Si encyclical adds a new dimension with great clarity. And it's about quality of life. And it's about healthy communities. And it's about nutrition, it's about eating well, it's about proper education about food, it's about the minerals that are added to the earth and the agricultural systems we put in place in order to be able to help people and parents and children as well, to grow into being more healthy human beings, with more health, so that there is not this great need for huge delivery systems of prescription or of response to disasters as they happen. So I think the encyclical is very strong in pointing out, that the care of creation, the care of and cultivation of the earth, and the delivery of good food, healthy communities, it will be a huge part of the response. So that's not, I think that's also saying here, and we have to balance that we each have a certain responsibility in this regard. Individually, parents, families, neighborhoods. There are a lot of things the government can do, a lot of things public service agencies can do, a lot of things NGOs and public charities can do. But there are a whole bunch of other things that individual families can be encouraged to do. But that's a transition that takes place, it seems to me, over a number of years. And so it's nice to see what, it's nice to see when local communities, local parishes get together on an ecumenical level or individually and create community gardens. I was in London 2 weeks ago, and I was in Paris, luckily, last week. It's amazing when you take the train in London or in Paris and you see that they actually set aside huge tracts of land for community gardens. So you get your 10-foot square of a plot if you live in an apartment building and you don't have a place to grow things, and you want to be a part of that system. So it's actually part of the planning of the village, it's the planning of the county, the planning of the town, so that there isn't this very isolated individual, let me take care of me and my family system, but there is a sense of a public responsibility that the community needs to be a part of. Last thing, I think it's extremely encouraging to see the number of communities that are into these 20-year planning discussions. I was very young a long time ago, believe it or not, and in a parish in Brattleboro, Vermont, a town of about 15,000 people, and it was 1979. Somebody came up to me one day and said, "We're forming a committee to imagine Brattleboro in the year 2000, and we'd like you to be on it." I said, "What?" I said, I can imagine where I'm going to be next week, and what bike I'm going to be riding, and what skiing I'm going to be doing, and when I'm going to get to meet my friends." But it's amazing the number of communities that have taken up that responsibility at local, very local levels, but very regional levels. And I think the participation of faith institutions and faith leaders in those conversations is critical. It's absolutely critical. If there isn't a voice that keeps reminding us that we have a responsibility to care and cultivate our common home, which is the earth, with all of the other species that inhabit it with us, who are interdependent upon one another. If that voice isn't a part of the way we plan our infrastructure, our transportation, our towns, I could go on. So it's important to find ways, I think, anyway, and as I said, I think a number of people are doing it because I hear about it in different places. Enough. How's that?
Good.
Thanks.